The Know to Prevent series in October. So let me start again. Welcome, everybody. Good evening. We are presenting the October webinar, I Am One and I Make One Choice, a data-informed, youth-driven prevention message for parents. Know to Prevent is a collaboration among youth-focused coalitions and agencies in Westchester with the common goal of empowering parents with essential tools to increase resiliency in our children and to reduce risky behaviors. For more information on the collaborative and upcoming presentations, please visit knowtoprevent.org. So before we get started, a couple of housekeeping items. We are recording the presentation this evening, and a link will be emailed to all of you and will also be available for viewing on our website. The same email will also contain a survey link that we ask you to please complete. It will take less than 30 seconds, and your feedback is extremely valuable as we continue the monthly speaker series throughout the year. The last item in the same email will be a handout called the tip jar, which will highlight takeaways, information, and prompts from tonight's speakers for you to keep as a reference. There will be a Q&A at the end of the presentation, and if you'd like to ask a question, please type your question into the Q&A box at any time during the presentation. Okay, as we begin, I wanted to introduce myself briefly. My name is Lisa Tomini, and I am the Coalition Coordinator for the Irvington About Safe Kids Community Advisory Board. We are a coalition of community members, educators, and parents working together to reduce use of alcohol and other harmful substances by our youth in the village of Irvington. We are pleased to be a lead organizer of this virtual speaker series that brings important information and resources to our families, despite the inability to meet in person. I have the privilege of introducing our distinguished speakers tonight, so I will dive right in. Dr. Robert Dupont. For 50 years, Dr. Dupont has been a leader in drug abuse prevention and treatment. He was the first director of the U.S. National Institute on Drug Abuse and the second White House drug chief. In 1978, he became the founding president of the Institute for Behavior and Health, a nonprofit research and policy organization that identifies and promotes powerful new ideas to reduce drug use and addiction. A graduate of Emory University, Dr. Dupont received an MD degree from the Harvard Medical School. He completed his psychiatric training at Harvard and the National Institutes of Health. Dr. Dupont maintains an active practice of psychiatry, specializing in addiction and anxiety disorders, and has been clinical professor of psychiatry at the Georgetown University School of Medicine since 1980. Dr. Caroline Dupont, in her role as Vice President of the Institute for Behavior and Health, focuses on the areas of addiction treatment and prevention. She maintains a private practice specializing in anxiety and addiction. Formerly, she was the founding president and principal investigator of DuPont Clinical Research, where she directed a team that conducted studies of investigational medication for anxiety and affective disorders. Dr. Dupont received her MD from the University of Texas Health Sciences Center and completed her training at the Johns Hopkins Hospital, where for years she held an appointment on the clinical faculty of psychiatry. She is board certified by the American Board of Psychiatry and Neurology and by the American Board of Addiction Medicine. Nancy Pasquale is co-founder and coalition coordinator of Rye Act Coalition, a drug-free communities prevention coalition in Rye, New York, right here in Westchester. Her professional background is human resources development and curriculum design. Ms. Pasquale oversees all programmatic aspects of RIAC's operations and serves as co-advisor of the Youth Action Team, working directly with youth leaders. Under her stewardship, RIACT has been recognized for exemplary leadership in youth prevention, including selection to the pilot cohort of CADCA's Graduate Coalition Academy. Ms. Pasquale has presented at CADCA's National Leadership Forum and at national conferences of the American Society of Addiction Medicine and the School-Based Health Alliance. I want to thank you for joining us tonight, and we'll hand it over to you, Nancy.
And share my screen. and get us in presentation mode to get started. Thanks so much, Lisa, for that great introduction. And we're really pleased to be here with you tonight. And we just want to talk a little bit about what you're going to take away from today. First, you're going to understand the unique impact that alcohol, marijuana, and nicotine and other substances have on the adolescent brain. We're also going to talk a lot about explaining how all youth drug use is connected. And one of the things that I always like to say, and I talk about this with my student leaders all the time, is this sort of means it's just a little beer is just not based in reality. And the kids like to say it that way. And we are going to share a little bit about why that is. And to know the facts that it's possible for young people to make the choice to be drug-free, and that the number of students, the number of young people who are in fact making that choice is growing every day. And I'm going to hand it over to Caroline to get us started setting the stage.
Excellent. Yes, I was thinking setting the stage or getting us all on the same page feels really relevant to all being here in this format. So we love speaking together, the three of us, and I hope that that's going to come across to everybody, because it's really a treat when we get to do this. But it's an especially big treat that we get to come and speak to this particular meeting of people. And so I just want to say what an honor it is for us to be able to speak to you. So I know this is a sophisticated group, and so I'm just making sure we're all together here, that we understand that we're talking about prevention. And one of the things that we have found is a lot of times really wonderful prevention programs do tend to be focused on a specific drug or a specific setting, or even in specific amounts of using that drug, for example, alcohol. And in this meeting, we're going to think bigger, because there is no good or safe drug for adolescents. Now, this slide is something I think you're probably all very familiar with, either in this format or in the format that has the developing brain all the way from young childhood. This we've chosen just to focus on these ages that are kind of the vulnerable ages for substance use. And the key to this is really showing that adolescent brain continues to develop all the way up into the mid-20s. And it really develops until the age of around 25, so all the way through college. And this is a tool that I think we can come back to over and over again when talking to youth and talking to parents and talking to doctors, to remind us why this brain is so vulnerable. Because anything that affects this brain during these developmental years can have lasting, lifelong impacts on the progression of that person in all sorts of ways. And we'll talk about that more. But I think this visual is so important. And the only part of this brain, all the way in that 20s, the one on the end, that is fully developed is the deep purple. And so there's a lot of growth going on. And this is actually good news, because people love to know their brain's still growing. My brain, not so much. But our kids' brains are still growing, and they love to hear that. And they love the idea of protecting their brain. And so that's going to be a foundation for a lot of our talks this evening.
Well, how does addiction happen? I've been working on the addiction problem for 50 years, as you have heard. And it's a combination of brain biology, genetics, and the environment. Drugs are very specific chemicals. They do things that other chemicals do not do. They superstimulate the brain's complex reward system. So what's that system there for? Why is it in the brain? It's hardwired into the brain to promote behaviors that are necessary for survival of a species, not just of humans, but all animals. The prototypes for stimulation of brain reward are food and sex. Animal studies where animals are given drugs and asked to choose the drugs or other activities, or asked to work to get the drugs, show that the animals will work harder for drugs than other rewards. This is what we mean by super stimulation. The brain's hijack the brain's reward system. The drugs actually work.
So in this next slide, I'm always excited that I get to share this particular one, because I feel like this was when I first met Bob Dupont as a speaker down in K.N.O.W many years ago at a national conference for prevention folks a few years back. This was one of those pieces of information that I found so, like, it was an aha moment for me, and it really goes back to that picture of the brain that you see, and this idea that substance use disorders are a pediatric onset disease. So I'm going to say those words again because I feel like they're so critical to understand. A pediatric onset disease. And what that means is that 90%, 9 out of 10 adults with a substance use disorder began smoking, drinking, or using other drugs before the age of 18. And the earlier and heavier the use, the more likely that a person will develop problems later. And hanging on to this idea as parents, I think, is one of the most important things that I hope that you'll walk away from tonight with. Just this idea that it's a disease that's it's preventable. There's something we can do about it. There's something we can do about it right now, and paying really close attention to this particular time in our children's lives and what's going on with their brains is so critically important.
This is stated to show what Nancy said about this onset in youth. And take a look on the left-hand side, just at alcohol, so you can focus on that one. And you'll notice that young people, 13 and younger, when they first use alcohol, so the first use is 13 and younger, 47% of them become adults with substance use disorders, 47%. Now, just 1 year later, at 14, it's 45%. 15, it's 38. And look at how that goes down to 21, it's only 9. It doesn't mean that adults can't become addicted. They can, but it's much more difficult, much less likely. The heavy risk, the biggest risks are the youngest ages. And you'll see the same thing is true for marijuana and for opioids. The brain, the younger the brain is, the more vulnerable it is. And this is the period of time when it happens.
So this slide, we're going to have a lot of other graphs. So really the point of this slide is just to remind us that alcohol is the drug of choice for most people, and it is the entry drug for most people. And so a lot of times we're very frightened about the other drugs, but keep your eye on alcohol. So this is Americans age 12 and older, and you can see alcohol is by far and away the most common substance that's being used. So as we talk about these shared risks, I want to make sure that we're not discounting our biggest offender here. So going on here, I want to then go back, having just pulled out alcohol, and say, look, all substance use puts adolescents at risk. And when you think about risk, we just talked about the risk of developing substance use disorders, which is obviously a very serious lifelong chronic illness. But early initiation and continued substance use also increases the risk of physical health problems, of mental health problems, of serious injury or death from accidents, of becoming a victim of violence or sexual assault, of having lower academic achievement, or having high school and college dropout rates. These are very serious. And again, these are the kinds of things that I get a lot of traction when I talk to the kids about. And I have to say, this particular generation, particularly that one about mental health, the kids are interested in how to protect their mental health. And here is a major key. So we all know that youth prevention is important, but is there a clear goal for youth prevention? So as I said at the beginning, many efforts tend to be specific to individual drugs or specific settings or even specific amounts. Are you drinking and driving? Are you binge drinking? I'm concerned about nicotine use or vaping. So we have these questions that we want everybody to consider. What do we mean by a drug? What does it mean to be drug-free? What are we preventing? This, I feel like, is a huge key, and it's so important to get this clear. Are we preventing use or misuse or overdose? And when we talk about youth, what does that mean? What age are we talking about? So we're going to kind of go through and explain why we think it's really important to have a clear message and a clear goal.
And so You know, moving off of what Caroline, or taking off from what Caroline was just talking about, what this means for us is that that One Choice is really about having a new vision for prevention, especially youth prevention. That is, and I'm going to move this real quickly so that you can see a little bit better. No use of alcohol, nicotine, marijuana, or other drugs for reasons of health for youth under the age of 21. And a refocus. The goal is a refocus of prevention messages and programs on One Choice as a health standard. And what we mean by a health standard is similar to other clear messages that there's universal support for across the board. Things like always wear a seatbelt. Not sometimes wear a seatbelt, not wear a seatbelt when you drive in this kind of car, but not that kind of car, but always wear a seatbelt all the time. Always wear a bicycle helmet. And we know parents who have kids of a certain age, we know that this is one that we have to work on a lot, but the standard is very clear and universally accepted. Avoid sugary drinks and eat a healthy diet. And exercise regularly. And so we're trying to put a message of non-use of substances for reasons of health. And again, that health is about protecting the brain health of children and of adolescents. And I'm going to pass on to Bob, I think.
Yeah, we got to. Oh, yes. Thank you very much, Nancy. The One Choice message gets away from this fragmentation and into a unified message. The devil's in the details, and this word experimentation is used all the time to say it's normal for young people to, quote, experiment with drugs. And it's often generalized and seen as desirable and inevitable. The problem with experimenting with drugs is that the young person might like it on very strong biological basis. This is an experiment that is dangerous and potentially deadly. It's also quite striking that all teen drug use is illegal for good health reasons all over the country. That's true for all drugs. It's illegal all over the country. And all the commercial industries, the alcohol industry, the nicotine industry, and now legal marijuana, officially discourage underage youth. We can debate about drug policy for adults. We can get a discussion about marijuana and alcohol and cigarettes and all the rest of them. But about youth, there is no argument. There's no argument that it is healthy or good for the young people to use drugs. Okay, Caroline and Nancy have talked about the substance-specific concept of youth, and God knows that's useful. It's good to say don't smoke cigarettes. That's good. It's good to say don't drive drunk. That's good too. But there's a fundamental aspect of this that's really important that is not substance-specific, and that's what we're going to talk about here. For teens, all substance use is related. The national data tells this story. The country keeps track of youth drug use with a survey that goes on every year. It's 17,000 youth aged 12 to 17, and it's conducted every year, and it's how we score youth drug use. And what we're going to do now, this presentation is about data. It's about research. So that's we're going to go right to the next one and start this and look at it. Now, I'm going to hold on to this slide for just a minute because we're going to see similar slides. And it's very important in this first one to get an idea of what we're doing because it's going to make it hard with the other ones if you don't. Now, look at that left-hand square. No past use. This is 12 to 17-year-olds in the United States who in the last 30 days before they took this test had not used any marijuana. So on the one hand, it's kids who've used and not. Now this on the left side, it's kids who didn't use marijuana in the last month. Now look at alcohol, the red one. That means that 8% of those kids who had not used marijuana did use alcohol. And 3.5% of the kids who did not use marijuana in the last month binge drank. And you see the other data across there. We're going to go into these in more detail. But now just look at the red one so you get the principle. Now, on the right-hand side, are the 12 to 17-year-olds in America, a whole sample of the whole country, who did use marijuana in the last month. 44.6% of them used alcohol. Look at the difference. The only difference between those two sides is, did they use marijuana in the past month or did they not? And we're going to look at this data in more detail now, but I want to be sure you understand what you're seeing, is you're going to see a lot of slides about this distinction that make a very strong case. Next. Now here I mentioned about alcohol, 8% to 44.6. That's 5.6 times more likely just because they used any marijuana in the previous month. Now we're going to look at binge drinking, 3.5 to 27.5, 7.9 times more likely to binge drink. And the only difference is, did they use any marijuana in the past month? Next, we've got the data on heavy alcohol use. That means repeated binge drinking. Repeated binge drinking is 0.4%, and those who didn't have any marijuana. And if they'd used any marijuana, it's 5.9%. It's 15.8 times more likely to report heavy alcohol use. And now we look at cigarettes. Of the youth who did, 12 to 17-year-olds who did not use any marijuana last month, 2.7% did use cigarettes. And of those youth who did use marijuana, at least some, you see it went up very dramatically. Here's that same data for other illicit drugs, 2.2 to 21.7, 9 times increase because of whether they used any marijuana at all in the prior month.
And this association is true for alcohol as well. So you're going to notice that these slides are very similar. They're a little difference with alcohol, and this sort of goes back to that idea of differences between some use and more use, right? So with alcohol, one of the things we measure is not just any use at all, but binge drinking and heavy alcohol use. So these charts work the same way. These graphs work the same way as the last ones, except that they break up alcohol by not just did you use alcohol at all, but did you use alcohol a little bit? Did you binge drink? And did you have heavy alcohol use, which would mean regular binge drinking or frequent binge drinking? So if we look at for those who said they did not use alcohol in the last month versus those that did. And again, to me, what I love about these bar graphs, and the first time I saw them, they literally made my head explode, because to me, the picture is so clear. Really little bars, really big bars. And the more and the heavier the use, the bigger the bars get. So for example, youth who did not use alcohol in the last month versus those who said they did, if they said they used some alcohol, they're 5.8 times more likely to have also said they used marijuana. They're if they binge drink in the last month, they're 9.9 times more likely if they've used marijuana than if they did not use, their peers that if they did not use alcohol. And they're 15.7 times more likely if they engaged in heavy alcohol use to have used marijuana. Though that same sort of correlation shows with other illicit drug use. So for example, for those who didn't use alcohol in the last month, 4.8 times, they're 4.8 times more likely to have used other illicit drugs if they did use some alcohol. If they binge drank, they're 7.6 times more likely to have used some illicit drugs in the last month. And if they engaged in heavy alcohol use, they're 16.8 times more likely. And the same is true for cigarettes. And I would just reference, and we'll talk about this a little later, that we all understand that these the surveys that we use to capture this information talk about cigarettes. Those surveys are gradually moving to talking about nicotine. And I think it's really important for parents to understand that when we're talking about cigarettes here, cigarettes are a delivery system. They're not the drug. The drug that's in the cigarette is the nicotine. And we are going to talk about that a little later, but I feel like it's important to mention it here as well. And this association is also true for cigarettes.
So now your guys have gotten really good at these graphs. And I think Nancy is absolutely right. The key is on the side that's no past month use, in this case, cigarette use, the bars are little. And if it says yes, past month cigarette use, the bars are big. And this is really fundamental. It once you get it, it looks simple. But when you think about what this means, it means that you can't say, like Nancy started with, it's just a little beer, because all of a sudden you realize that just a little anything is a gateway to a whole association. So I'm going to go through this group very, very quickly. Again, as Nancy said, we're asking about cigarettes, but we're going to talk about vaping, don't worry. So you can see, again, look, 4.2 times more likely to use alcohol if they've used cigarettes in the past month, 6.1 times more likely to binge drink. So again, I kind of just go back to the percentages for a second. If you see that these some ways it's hard for me to understand what that means, 6.1 times more likely. So sometimes I like going back to that 4.4% versus the 26.7%. You know, if you just think about 100 kids in a class or something like that and seeing what that means in terms of actual people. So, okay, so then that one was binge use alcohol. And we know our high school students, unfortunately, do a lot of binge drinking and heavy drinking. So this is the heavy drinking. And even though that bar looks little, that's representing a pretty scary number of people, 10 times, 0.4 times more likely to report heavy alcohol use if they've smoked cigarettes in the past month. And that marijuana connection cannot be discounted. So going up 7 times more likely to use marijuana. And then the other illicit drugs, and this could include stimulants or opiates and other drugs. And so that has a lot of the drugs that we tend to kind of worry about as drugs, but actually all of these things are connected. So what I'm going to talk about here is one last slide that, oh yeah, go to the next slide. That this one looks like it's the same, but I just want to back off for a second, and just because we love data, and so you have to always make sure you understand the data. So this looks like it's the same thing, but that was national data, and this is high school students from Colorado. And so this is a 2017 study in Colorado, and it's great though because it shows exactly the same thing. And so as Nancy said, we've changed the nicotine delivery device for these kids from cigarettes to vaping, and you see the exact same correlation, that if kids are not vaping, they're actually very low risk to be doing these other behaviors. But if they are vaping, it's very high. And this is one of my things, I feel like vaping really slid under the radar for a lot of parents, that they saw their kids as vaping and thought, it's not that serious. It's not really like smoking. It's not really a problem. But they didn't see this data and realize what the significance of that vaping was in terms of use of other substances. So the importance of these findings, we've just gone through these, all these graphs, and I really hope you'll take time to study them in the future, because they really have such valuable information in it. But the point is that what we're showing is that there's a generalized risk for substances consumed by use on the basis of whether they choose to use anything. So once they've made that first decision to use any substance, their risk of using other substances and heavily using other substances is so much higher. And that underscores this need for this clear goal for youth prevention of no use.
So again, I just want to go back to say one choice, right? It's one choice for a reason, because the key is that once they make one choice to use one of these, and it matters not the order in which they initiate use, it doesn't matter which one they use first, the likelihood that they will use other things increases exponentially on all fronts. When you use any one of these three, the likelihood that you'll use the other two goes up exponentially, and the likelihood that you'll use other drugs goes up exponentially.
Nancy, before we go on, can you go back to 33 for just 1 minute?
I sure can.
Okay, that's fine. That's it. Now I want you to notice at the bottom of all of these slides, it says where the source is. Do you see that down at the left at the bottom where it says Dupont et al. 2018? All of this data is from the Institute for Behavior and Health. This is our study. Now, we used the data from the national surveys, so we didn't collect the data, but we organized and put it together in a way that had never been done before. And it was putting it together like this that got Nancy involved and got us together and doing what we did. But I wanted to be sure that it's a matter of some pride, but I think also importance to what we're doing, that all of that data came from published, peer-reviewed literature that we have submitted to the research community in this country. Go ahead, Nancy.
So the next question really becomes is, and I can feel the parents out there, even though I can't see you. If we were in a room, I would be asking you right now to raise your hand, right? I'm a mom of 2 teenage boys. I was a teenager once. I get the question, right? The question is the one choice goal of no use realistic? And the answer is not the answer that I imagine or that I guess or that I think. It's an answer that we know, and I'm going to repeat what Bob said. It's an answer we know from data. Youth are telling us what they're doing, and they're telling us. So this graph shows some data from a particular data set called Monitoring the Future. And I think it's important to pause for a moment to just talk about Monitoring the Future, which is another national data set. And important to note that our friend and my dear friend and colleague, Bob Dupont, is the reason that we have this data going back this far for this long, because when he was sitting in those important chairs, making policy and thinking about how we should as a nation be thinking about prevention and youth and substance use and treatment in those important roles back at that time, he knew that leading from data and that looking at data and having good data to make from which to make policy decisions was critically important. And so I just have to share that I'm proud to know you and proud to be able to say that I know the person who is the reason we have Monitoring the Future data. And the other thing that Caroline and I always sort of laugh about is that if you think about people who are the age of, parents of teenagers right now, and that would be me. This is me, right? This is me in high school, 1982, 83, 84. This is me in high school. So when I said to my parents, everybody uses drugs, the truth was almost everybody did. Look at these numbers. This is non-use was really, really very low. Back here in the 70s, 1978 was the absolute dip. And if you look at the line along the bottom, it talks about lifetime non-use. If you look at the line along the top, it talks about past month non-use. And this continues today through to 2018. So if you look at this trend, 57.6% of high school seniors in high school in 2018 said they had not used any alcohol, cigarettes, marijuana, or other illicit drugs in the last 30 days. And 30.7% of them said they had never used them in their lifetime. So to turn that into something that means something as far as people, what I want to say to you is in that 2018 number, there were roughly 3.7 million, according to census data, 3.7 million high school seniors in the United States. So what those percentages mean is that there were over 2 million high school seniors who had not used a drug in the last 30 days in 2018 when that data was collected. That's over 2 million kids. And over 1 million had said they had never used in their lifetime. So the next time that your child says, everybody uses, the answer is, no, they don't. Maybe when I was a teenager, that was true, way back here when dinosaurs roamed the earth. But now it is certainly not. And another really great thing to mention is that if you have a local coalition in your area, they will have data like this that's local to your community, and they can help you understand what that looks like specifically locally for your community as well. And if we look at this is a similar chart that shows, again, lifetime non-use and past month non-use, but this shows 8th, 10th, and 12th graders, which are the ages that are captured in that national data set. And so I feel like, again, if you look, those numbers are even higher when you're the younger the kids that you're talking about. So this is a lot of kids who are not using. We need our kids to know that they're out there. And I'm turning it to you, Bob.
Oh, don't you have the 37? Did you do 37? Okay. Yes.
I did.
Okay. Can you go back one more time to look at, I want to see that down in the bottom, who wrote that article. You see Levy was the first author. Sharon Levy works with us at IBH. She is a leader of the American Pediatric Association dealing with drug abuse. All the pediatricians in the country. She is a leader. She's at the Harvard Medical School and is a phenomenal person. I'm an author on that, but she was the first author on it. That was the data that Nancy's been talking about. And again, that was our research published in national literature. In fact, the update of it is coming out shortly in the Journal of Pediatrics. So we can go back now to the next one. Historical lessons. Okay. Now I'm going to give you back to the long-term perspective on this. And just, this takes a minute to look at this slide. So take a deep breath here and just look at alcohol. What this shows is going back to 1975 with the Monitoring the Future data, what percentage of high school seniors had used any alcohol in the prior month? That's the red line. How many of you watching this knew that the peak of that number was about 1978? And look at there, it was about 72, and now it's 30. We're worried about alcohol for good reason. It's still high, but compare with what it was in 1978. That's the percentage of American high school students who've used any alcohol in the prior month. Now look at the purple line. That's the cigarettes. And you'll see it has a different slope. It doesn't go down until about 1997. And then it goes down precipitously, sharply. That was the tobacco settlement where millions and millions of dollars was put in to educating young people about cigarettes, and a great job was done. And you'll notice that precipitous decline. In about 2008, you'll notice that marijuana passed cigarettes. See that? But what I want to show you is look at the marijuana numbers. This is really the green line. You'll notice that all of them peak at the same time, about 1978. That's kind of interesting. They're all peaking in those years. We don't think about that. That was why we had the parents' movement, because there was a crisis in what was going on with kids, as it had been going up very dramatically for the last few years. And you'll notice with marijuana, the steep decline between about 78 and 93, 94. You see that decline? That's the impact of the parents' movement. And the epicenter of the American parents' movement was in Westchester County. You were the center of what did that. That was a 62% drop in youth marijuana use. People say it's inevitable. There is evidence that in that 12-year period, it went down by 62% because the country got mobilized about marijuana. And then you see the peak the coming up.
And Bob, I would just repeat, the mobilization came from parents. So I know there's always a question of, does what I say matter? And does what I think matter? And does how I talk to my kids matter? It matters, right? It matters.
And it also wasn't a program.
Right.
There was no program of what people keep talking about, a prevention program. This was not a program. This was a mobilization of the country around the concern about youth marijuana use. But you see it comes up then. You've got an inflection point back there about 1992. And then what you've got is a different slope entirely. And unlike the cigarettes, unlike the alcohol, you got a pretty level line, maybe a little bit up in the last couple of years, but basically from about 1997 to the present, it's pretty much level. And that level is in contrast to what's going on with cigarettes and alcohol. And that is the marijuana legalization movement. The whole normalization of marijuana as a medicine and as harmless and all the rest. So it's on a different trajectory, but even with marijuana and even with all the legalization, everything else, it's way under what it was in 1978. So the big takeaway I want you to see from this is the downward trend. It's the inverse of what Nancy was showing you about the no use. Now here we project out those numbers to get some idea, and you'll notice it doesn't take very long before marijuana and the current trends is going to pass alcohol out there, as it has already passed cigarettes in 2008. So that's the trend. Okay. Now here the last of mine at this time. The lesson from cigarettes is very important because we were focused on the national effort to stop cigarette smoking was blindsided by vaping. The whole effort was wrapped around cigarettes and not nicotine. That was a mistake. And the reason it was done was because it was a target that they could get because of people having lung cancer from cigarettes. I understand that. But what that did was encourage the emergence of vaping. When there's no smoke, you don't have the cancer concerns that you did with cigarettes. And that led to an epidemic you're going to hear more about vaping. But you'll notice 4.7% of middle students and nearly 20% of high school students. That has to do with this specific about cigarettes instead of focusing on nicotine.
So we also like to talk about kind of the commercialization of this, and we'll talk about that more later. But one of the things that happened with this was this change in the delivery device, and we found that they could capitalize on changing that delivery device. And if you look at the original Juul patents documents, they are very proud of the fact that they've come up with a delivery device that is makes that nicotine more readily available to the lungs, and it doesn't get absorbed in the mouth or in the esophagus. It goes right into the lungs and gives you more bang for your buck. And they're also very proud that they found the correct aerosol containing organic compound to mix it with to make it less toxic feeling, and so you're able to use it more without getting all of those annoying things like coughs and things like that. And they made it so accessible for the very people who had that wonderful downward trajectory of nicotine use under the word of cigarette use. So just going back and thinking about those graphs that we showed again, we just want to remember that all substance use is connected. And so you look at whether do youth who vape use other substances? And we know from our graphs, they do. So among 12th graders who vaped in their lifetime, 96% used other substances. So again, those parents that would say to me, oh, not that worried, my kid just vapes. Look at that data. That data tells you something. Among 12th graders who vaped in the past month, 82% also used other substances in the past month. These are huge numbers that are showing that one choice. Once you've opened that door, am I going to use this substance? All of a sudden, you've opened up a whole range of other questions. Am I going to use this substance? Am I going to use that substance? Am I going to use it in this circumstance? Am I going to use it in that circumstance? Am I going to use this quantity or am I going to use that quantity? Am I using this delivery device or am I using that delivery device? And so that brings us right back to one choice. And this is why we think this is so important, this concept of it really being one choice that people are making. And when you go back to those numbers that Nancy showed us, which just make me so happy, that over 30% of high school seniors who've never used anything in their lifetime, and over 50% that haven't used any in the past month, that is really showing that these kids can make this one choice and they can protect their health. I just want to separate us a little bit from this question of, is this the same as the Just Say No campaign? This is a question we usually get, and so we thought, let's just put it out there to begin with. We really are thinking about this as a health issue. This is not a moral issue. This is really backed by data, and it really is backed with the data of the developing brain and by the data of the connectivity of all the substance use. And this is not a program. We're not saying, here's our prevention program, it's better than your prevention program. We love your prevention program. This is something we want to give you. to help support all other prevention programs. Use this data to help other efforts. And one of the things that we really value is this promoting of teen self-care and autonomy. Teenagers never have liked to be told what to do, but I would say particularly this generation is very savvy, and they're very self-aware, and they are concerned about their mental health, and they're concerned about their futures. And these tools are really important for them to understand. And also, this is an opportunity to develop leadership so that 26%, or now it's, I used to say 26%, now it's the 33% that have never used in their lifetime, and the over 50% that haven't used in the past month. This is an opportunity to give them a voice, to give them a platform where they can feel proud of who they are. This is a group that has traditionally flown under the radar. Back in my generation, we flew under the radar because we were pretty weird, but they're not outliers anymore. Okay, so who can make one choice? Again, super important to understand this. This is not a purity test. Anyone can make one choice, okay? So we often talk about this, we talk about that lifetime, and that's amazing. That lifetime numbers really do excite us, teams who've never used any substance. But we are equally as excited about that past month data. So teens who've already used in the past but decide to make one choice today, we are so in favor of that. That's like someone saying, you know, I didn't used to wear my seatbelt, but now I'm thinking I should wear my seatbelt. Yay! We're not going to say, oh, we're giving up on you. Wear your seatbelt today. What a great plan.
Right.
And individuals who have already had a substance use disorder also can make one choice. This goes along well with early and long-term recovery. And I think that's really important, that this is a cohesive message for people, especially as Nancy said, we're really focusing on youth. And so under the age of 21, this is a message that anybody can make one choice. And it's so important that we keep going back to this is a message that's supported by science and data.
And so now we're going to talk a little bit about the essential role of parents and caring community, adult community members in supporting one choice. And one of the ways that I think we do, just to piggyback on what Caroline was talking about, is that we get excited about all kids who make one choice, not just the ones who make it all the time or every day, but every time they make it. So as a person who's spent a lot of time in education, I think if we think about things like a growth mindset, right? Like about the idea that we're always learning, we're always growing, and we can learn new things and make different decisions. And so I think of that higher number of kids that falls in that past 30 day as a really sort of fertile ground for saying, you made a really good choice right now. Keep making that choice. Did you make that choice because you learned something new, or you found something out, or you saw something that you didn't like? And when we talk about supporting, I want to just make a note that adults and teens kind of live in different places here. I find in my work in my own community, and when we've shared this message elsewhere, that adults are frequently more doubtful that goal of no use is possible, versus for teens, many of them have real life experience where they're either making that choice themselves, and they're excited that somebody finally noticed, right? Because I think about as a prevention person, and when we talk about, student survey data, we're always talking about the number that used and the number that used. And if we constantly focus on the ones who do and never flip that narrative to talk about the ones who don't, we make them invisible. And I, for one, don't want to make those kids invisible. And they get really excited about somebody noticing, wow, you're making that a really healthy choice to not use, a really healthy choice for your brain. Adults tend to second guess how to articulate that message. And so one of the important things we can do as a strategy as adults is to practice. We can practice, we can learn more, we can find some ways. And later we're going to share some resources for you about some places you can go to get some ideas about how to articulate that message with your children, or with teens and young people that you work with. And sometimes I find that adults do tend to perpetuate sort of a concept, and this concept is also perpetuated in the media, right? It's perpetuated in social media, around which a lot of researchers are now calling sort of the super peer, right? Social media as super peer. That there are a lot of images out there that perpetuate the idea that everybody uses, and what teens are telling us is that in record numbers is that no, they're not. And so we need to help talk about that message and put forward that narrative. And we need to engage youth in being the ones to do that, right? And especially I find for this, and Caroline, you touched on this as well, that this is a generation that feels like it's really important to make an impact on the world they live in. And so this is a place for teens who are making this choice to have a really big impact on the health of not just themselves and their community and their peers, but nationally. There's that being part of a national trend is powerful, and helping kids know that they are and connecting them to that is really powerful for young people. So some of the things that caring adults can do right now is to talk early and often about an expectation of no use. And if you want to talk to your child about the why, we've given you a whole bunch of information about the reasons why. That the adolescent brain is particularly vulnerable. According to the American Academy of Pediatrics, more uniquely vulnerable than any other age group or cohort at any other age to problems with substance use later in life, such as addiction. So protecting their brains now is part of the reason why, right? So when we talk to our kids about that expectation, we can also talk to them about the why. And to fit that one choice message into your family's and your community's vision for health and wellness, just like we talk about wearing a seatbelt, just like we talk about getting exercise every day. It's in that same continuum. And to talk about this sort of elephant in the room around marijuana. And for those of us who are living here in Westchester County and in New York State, we know that this is a big one, right? And I think one of the important ways to sort of think about this, because I know that there are many who, there are lots of arguments and conversations about why marijuana legalization should or shouldn't happen. But I think it's really important for us to recognize that particularly in our country, the marijuana industry is commercialized for-profit industry. It is a for-profit industry. And what it is selling is no different than what big tobacco was selling when we were kids and back in the 50s and the 60s, right? So we have side by side here two different images that show how physicians were used as part of messaging to normalize the idea that somehow cigarettes were good for you. This was common practice. And the marijuana industry is using that same playbook that we all know now in retrospect that big tobacco used. Side by side, it's the same, it's that same story. And where they make their money is on heavy, regular users. The marijuana industry, just like the tobacco industry, just like the alcohol industry, does not make money on me who maybe has a beer once in a while when I go out with friends or occasionally has a drink at a social event. They make money on regular use and heavy use.
So I want to just touch on this one briefly. So this is just if you're on your Google Maps and you look up in the city of Denver, Colorado, and you look for marijuana dispensaries, and this is what you're going to get. That's what you're going to get. Now, if we look at the next slide, I want to show this in a slightly different way. So think about that map, but look at this. So we have Denver dispensary count. This is from 2018, okay? There were recreational dispensaries and medical dispensaries. And so they made that distinction. There were 169 recreational and 195 medical dispensaries for a total of 364. To put that in perspective, at that same time, there were 80 Starbucks and there were 31 McDonald's. That just blows my mind, because you think, I feel like if I want to find a McDonald's, or I want to find a Starbucks, I mean, think how easy that is to do. Anywhere I'm driving across the country, I can find a McDonald's. But imagine in the city of Denver, look at that difference. 364 medical places you can buy marijuana, either medical or recreational, to 111 Starbucks or McDonald's. And then this other side is Colorado, so the whole state. And again, you're going to see that same kind of thing where you have a total of, when you do the two different things, of 1,021 places you can buy marijuana. And this time we've compared it to Starbucks and Walmarts. And if you combine all your Starbucks and Walmarts in Colorado, you only have 428. But you've got 1,021 places that you can buy marijuana. And the reason this is so important is because we're talking about what are things that are affecting our youth. And what we know about youth use, well, any use, but particularly youth use, is that the things that increase use are easy access, social normalization, and a decreased perception of harm. And if this is what your environment you're living in, just think what that's going to do to that access, normalization, and perception of harm. And what is that going to mean in terms of use?
Okay, this is a bigger context of thinking about what is going on. Caroline and Nancy have been talking about the commercial aspects of what's going on. And the larger context is that the problem we have with drugs is what we have called commercialized recreational pharmacology. That is the use of chemicals that superstimulate brain reward, that are promoted by a for-profit industry and driven by the exploitation, as Nancy said, by people who are heavy users, and that is people mostly who started in their youth, what we're talking about. So it's a commercial operation using the brain's reward system with chemicals that are sold. And the emergence of vaping and the delayed public health response is an example of how small shifts, or relatively small shifts, make a profound difference in this. New delivery systems are created, new potencies, new drugs. That the change in the American drug scene is to have ever more drugs, more different drugs, at a higher potency. You see that about marijuana. It used to be 2%, and now it's 30 and 50 and 80 and 90%. And it's more different products to make it more attractive, and it's sold more conveniently. That is what is going on. But also, before we get away from the slide, say one other thing. This is talking about legal, but the illegal drugs are also commercially driven. Both legal and illegal are commercially driven. And one of the things about legalization is, in Colorado is a great example, legal marijuana has not put illegal marijuana out of business. Illegal marijuana is booming in Colorado because it doesn't pay taxes. It doesn't have regulations. A joke a friend of mine said, the only people in Colorado who buy legal marijuana are people who are from out of state and don't know any better, and people who belong to AARP. The other consumers don't.
So the other thing that I think is really great to talk about, and we're in our last couple of minutes here, so we're gonna try to wrap up, is that youth are particularly love this message. They don't like the idea of being played. And so if we can help them understand the context in which these conversations about things like legalization, things like substance use, and the normalization of substance use, if we can help them understand the context for that, they feel like they're being played, and they don't really like that feeling. And it's a powerful, powerful prevention strategy, parents, to help kids understand that, because once they get that, they don't like it and they don't want to be part of it. So I just to share a little bit about how we have gotten involved in this, is that we decided after I met Bob a few years back and heard him talk about this before it was even fully formed as one choice philosophically. when I heard him speak and I heard him start to present this data in this way, I literally accosted him and said, you have to come talk to my community. You have to come now. Like, you have to come tomorrow. Because we had a lot of folks, like many communities, who were very, very deeply concerned, as they should be concerned, about things like the opiate crisis and things like overdose deaths. And obviously we need to be concerned about those things. But the reality was, in our community, that the data was saying that youth were using alcohol, nicotine, and marijuana. The amount that they were using other drugs that they were very worried, that parents were very worried about and the community was very worried about, was much, much smaller. And so putting this whole framework before parents felt really important. And as we've done this, we've actually had some tremendous results. So we've seen a 42% decrease in past month alcohol use in over the course of 3 different surveys between 2014 and 18 for 8th graders, reductions for 9th and 12th graders, reductions in past month binge drinking. And again, if you remember, the amount of use, the heavier the use, the greater the likelihood of problems. So binge drinking, and we also know that binge drinking is a particularly risky type of behavior. Among all types of drinking, it's one of the riskiest in terms of outcomes. Past month marijuana use, even in the face of legalization conversations, we've seen past month marijuana use go down across our 8th grade, 9th grade, 12th grade. And our past month non-medical use of prescription medications go down. So the one choice message has really been driven in our community and across the country. Again, they didn't even know it, but kids across the country are driving this conversation through their choices. Our job is to help reflect those choices. And one of the ways that we've decided to do that is through a campaign that we call I Am One. And I Am One may seem like, well, what difference does one person make, right? So what I want to share with you is that our I Am One campaign has 2, and our I Am One campaign is a one choice campaign. It's about I am one and I make one choice to be drug free because. And what we did was we invited youth in our community to just share with us. And they had 2 different ways that they could do that. One of those is through what you're seeing here, which is a mosaic wall. And this is an opportunity for youth to anonymously, if they want to, or not anonymously, if they want to, make a tile and say, I'm one and I make one choice and here's my reason why. And the kinds of reasons are, I have a history of substance use in my family and I don't want to go down that path. I've seen things on here and they always make me laugh, like, I want to make my mom proud, or my mother would kill me, or, or things like, I want to be a good example for my brother or my sister. I want to have a good future and I care about that. The reasons are various and numerous and personal for each kid, but giving them a chance to share those and to see the power that when you take that one and that one and that one and you put them together, there are actually many. This mosaic wall was put up in our community. I asked my youth leaders how many tiles they thought we would get. And I asked them to dream big and they said 50. At the end of our prevention fair we had, and I told them I was aiming for at least 100. And then I told them really my goal was 500. And they looked at me like I was crazy. This wall now has over 800 individual tiles of young people in our community in middle school and high school who have said, I'm one, I make one choice to be drug-free, and these are my reasons why. The second component of that is a video that I'll share with you now.
Many young people feel like the only one when they make the healthy decision not to use alcohol, nicotine, and other drugs. The truth is, most RY youth do not use substances, and that number is growing every day.
I am one. I make one choice because I want to be healthy and happy, and I want people to know that it's okay to not want to drink or do drugs because everyone else is doing it. I want people to know that you don't have to feel pressured into doing something you don't want to do just because everyone else is doing it.
I am one. I choose to be drug-free because I am a student and I'm an athlete, and I want to keep my body healthy for as long as possible.
I am one. I don't do drugs because I want to feel like I'm in control and I want to be able to make my own choices.
I am one, and I make the choice to be drug-free because I'm an athlete and I want to keep my body healthy.
I am one. I make one choice to avoid drugs and alcohol to pursue a childhood dream. Growing up in a basketball family, I had a lot of role models that were great basketball players and hardworking people. From then on, I decided that I wanted to play Division I basketball. My priority was to become a hardworking, successful Division I athlete, and I avoid drugs and alcohol to maximize my athletic ability and to optimize all the opportunities that I have.
I am one. I make one choice to be drug-free because I don't desire to put them in my body.
I am one. I make one choice to be drug-free because I want to be a role model to my younger sister and to my teammates.
I am one. I make one choice because I don't want to be controlled by anything.
I am one, and I make one choice to be drug-free because I have a goal to pursue neuroscience or neurosurgery, and that's something that really interests me. And making sure that I'm staying off of drugs is important in making sound decisions for myself and in the future for others, hopefully maybe patients. So it's important that I keep my mind where it needs to be in order to reach my goals.
I know in making the choice to be drug-free, you can feel alone.
But we want you to know that you are not alone.
Because I am one.
And 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 I am one.
Let's make one choice together.
So I share that video, and I do have to tell you that Tegan is a Division I athlete, and she is playing basketball in college this year. I also want to share with you that that was scripted by them in their own words, just them talking, and their words to share with their peers and with adults about why they make one choice to be drug-free. And I'm just going to take us to our last slide if I can get there. Oh, and maybe I need to get all the way there to get there. Thought I could do that. There we go.
It wouldn't let you skip anything.
It wouldn't let me, and we want to get to questions. So
yeah, we got to do it. Well, I want to end up here to remind everybody about the unique impact of marijuana, alcohol, nicotine, and other substances on the adolescent brain, and that all youth drug use is connected. Youth are making the one choice more than ever before, and it's our job to support them. Remember that this initiative, this direction is youth-led, youth-created. We discovered it after it had been going on for 30 years undetected. And it's very important to see that it is the youth. I also think it's terribly important to understand that this is data-driven, science-based. That is very important. And finally, I want to again thank Nancy for her leadership in this, and the Westchester County, and especially Rye, New York, and Rye Act. It's just a great privilege for me to be working with all of you. And I think we're going to do it again to lead the whole country. And I'm telling you, I'm committed, Caroline's committed, we're committed to joining you in not just in Rye, not just in Westchester County, but for the whole country. And once again, you're in the lead. Thank you.
Thank you so much, Bob, Caroline, and Nancy, for that extremely informative presentation. At this time, we will be moving into our Q&A session. If you have not already done so, please feel free to type in any questions in the Q&A box. While you're doing that, I just want to say a quick reminder, be on the lookout for that email that will include the recording from tonight's presentation, the event survey, which we again, please ask you to fill out, along with the tip jar handout so that you have something as a reference as you reflect on what has been presented tonight. Our next webinar, which I wanted to share, and let me just kind of get there, is the Youth Vaping Epidemic, what parents need to know and how to protect our kids. We encourage you to sign up for that, and you can register for this event and other upcoming events on our website, notoprevent.org. And so with that, let's begin the Q&A. I will throw out the first question here, and you guys can feel free to duke it out amongst yourselves.
We tend to do a little tag team, so.
Okay, the first question was, how do I begin to prepare my 7-year-old who is adopted that drug addiction is part of her birth history and make her understand how important it is that she avoid drug and alcohol use?
So, one thing to say is that this is an entirely preventable problem by one decision. Go ahead, Caroline.
Oh, I think that was perfect. I was going to say, the thing that's really important is I love you're talking to your 7-year-old. This is a conversation. It's not a one-time conversation. This is a whole family philosophy. It's a whole opportunity through conversations over many years and in many different conversations. And the key that Bob just said is really important for everybody, family history or not. The biggest thing is whether they use. And it doesn't matter if you have 0 family history, use puts you at risk. But someone who has a family history has a higher risk.
Right.
We mitigate that in all sorts of other ways in our life. Maybe we have a cardiac family history or we have a cancer family history. And knowing that is power. And so I would think about it not as a weakness, but as power.
I just will piggyback to say, just to remind people that as much as that family history is important, we know from this data that we've just shared, and you now know from that data, that youth is a risk factor.
Yes, that's right.
Being a youth is a risk factor in and of itself. So both of those things are really important things to share. And I love that this particular parent is thinking about it and talking about it now, because there's no more important time. The best time for prevention is before your use starts, right? And being open and honest with your child about expectations and being open and honest about history that may impact them are all important parts of that conversation. It's a great question. Thanks for asking it.
And let me switch gears now to the other end of the youth age range. My 15-year-old has already smoked pot, drank alcohol, and smoked and vaped. He likes it all. Now what?
Bob, I'm going to let you go there first.
I went too soon last time. Yeah, the drugs really do work. They capture the brain reward, and the kids like it to do it. Not everybody, and some like it more than others, but basically the drugs work. And the issue is, the more the person likes it, the more there's a problem with the use. And so the fact that this young person, very young to 15, likes it is a very bad prognostic sign for him and for you to think about. And so I would think some serious interventions are important to let that young person know that this is unacceptable behavior for his own sake. You're going to do that. Now, you don't throw him out of the house, but you do whatever you can to incentivize him to not use.
And I think certainly too, finding your way to some supports in that. I think and especially if you're saying your child has used multiple substances, it may really be a good moment to seek out some additional professional support. And for parents, that can be really critical. And I know Lisa's going to share a few places specifically in Westchester that if parents feel like they're having a problem that maybe is getting past the point that feels like they can manage it alone, that getting help is the best possible thing you can do. And your local coalition, if you don't have one, or if you don't know where it is, you can find it on the Power to the Parent website that lists all the coalitions across Westchester County and contact information. So we are great resources for you. That's part of what we're here for, is to connect you to help if you need help. And then also there is there's a crisis line if you really think you're in a crisis situation where you need maybe some triage assistance, figuring out what support your child or your family might need, and also the Family Navigator system. So there are a few different ones, and they are local here, right here in Westchester, and they're fantastic. We have so many tremendous resources available for families who need some assistance in navigating this. So don't hesitate if you're worried. Get that assistance. Go find it. It's there, and we can help you find it.
I also want to say we are worried. Like, this question makes us worried about this young person,
Right.
but we can also be very hopeful. And I want to be really clear about this. This is not like, oh my gosh, this terrible, and no one can ever recover from this. Recovery is absolutely possible. It's just you want to get it as early as possible. And this person is at really high risk with that multiple substance use and the fact that they like it. That's called the hijacked brain. And the hijacked brain is a real challenge for anyone at any age, and you really are going to want help. But I want to be hopeful and say the skills that this young person can learn are going to be things that they can take forward in a really productive, happy future.
Right.
Great, thank you for that. Next question is, how influential are behaviors of parents and caregivers in the household? For example, a glass of wine during weekends, beer after sports, social gathering, drinking at social gatherings, etc.
Well, I will say that parental drug use, including alcohol use, definitely models the behavior. But I think the parents can make it very clear that whatever they're doing is not for kids. That's why I'm drawing that line. I don't think you want to get into the question of whether the kid is, and when he's 25, is going to drink or not, or whether he's going to use medical marijuana or something like that. That's a discussion for a later time. I think you don't want to take all that on. Just take on the issue for kids because of the unique vulnerability of the brain,
Right.
and help them see that is in their interest to get them where they want to go.
I think that brain, that's where that brain development is so useful, to really say that adult brain is fully developed and is much less vulnerable. But I want to put in a little thing here, though. I think what you do does matter. And I think your kids are watching you all the time. And one of the things I worry about a lot is parents modeling drug use, frequently alcohol use, as their way that they relax, as their reward. There's a kind of mommy wine culture right now that I think is actually very dangerous, because you're really modeling coping strategy of turning to a substance as your coping strategy. So I would ask you to be a little self-reflective. Yes, it's legal for you, but think about what you're modeling for your child, and frankly, think about your own health as well.
Great, thank you. Next question is, how do we keep kids from smoking and drinking when it's so glamorized by some celebrities and sports figures / athletes? For example, NBA stars celebrating wins by smoking cigars, and NFL players smoking marijuana, and so on.
So I'm going to just jump in partially to do a very shameless plug for a future program that we're going to be doing in April, where we are going to be having David Jernigan come in and talk about, and one of the things that he talks about specifically about alcohol, but one of the things he talks about is social media as and I mentioned it earlier, as like a super peer, right? And this is something that as parents now we grapple with. You know, there were always outside influences and cultural influences and societal influences, but in the age of digital media being what it is, and the amount of social media consumption that kids have now, we know that it's heightened in a way that it never was before. So it's a great question. And for me, the answer is really in that video that I showed you, which is we have an obligation to have a counter narrative, right? we can have a counter narrative that is a narrative about kids making healthy choices and healthy decisions. We can, as parents, and this is sort of related to what Caroline, what you were talking about with that last question, right? If it's okay to occasionally have a drink as an adult when you're in a celebratory atmosphere. But if we model for our children that the only way to celebrate is to have a drink or to use a drug, then we're modeling a behavior that may or may not, like if we think about what are the connections that our kids may inadvertently be making from what they see in our behavior. So I do think that it's important to think about that in that way. But I think the most powerful counter narrative is the narrative of youth themselves speaking up and being and us elevating their voices to say, there are lots of people who don't make those choices and you can be one of them.
I think what also I'd like to just say is that you can kind of cherry pick the stars who are using and glamorizing it, but there are also people who've had horrendous tragedies, and so it's very easy for me to identify all sorts of both sports stars and entertainment stars who have lost their life and who have had horrible consequences to their substance use. And then on the flip side of that, of people who are in recovery, and there are wonderful role models in that kind of super famous people who are in long-term recovery, and even some who talk about their non-use choices that they've made their whole life. So look for those too.
Yep.
I would like to bring up also another thing about this. We're talking about the effect on kids of the adults using drugs. Let's turn that around. Kids who make the decision not to use are having a powerful effect on their parents. Mm-hmm. There are very many parents who've come to terms with their cigarette habit, who've come to terms with alcohol and drugs as a result of interventions from their children. That's very common and very important. Don't underestimate the power of a kid who gets mobilized with this message.
Excellent point. Excellent point. I have somewhat of a geographic specific question, but I'm going to put it out there. Historically, in Hastings, which is within Westchester, there has been a spot in the hillside woods called PADJ. This is my own insertion here. I think there are a lot of communities throughout Westchester and nationwide where there is that one known quote unquote spot. So I think we can all relate. Parents and police know about it. Drinking and drugging is still going on. What can we do about it? Nancy, this might be a good one for you as a coalition leader.
So the first thing I will say specifically to this person who's asking a very Hastings specific question, you should know that Linda Facina, who is the coalition coordinator, one of our colleagues at Hastings The Way, is one of the coordinators of this No to Prevent group. And so she knows about your question and will definitely follow up directly. But I would encourage any parent, right? It's likely that information is something that your local coalition is aware of. But there's a chance that they're not also, and it doesn't sound like in this case, right? But I think the number one best thing that you can do is get involved and get engaged with the work that your local coalition is doing in your community. Find out some aspect of what they're doing, because they're doing that work across across a broad spectrum of sectors of the community to address that problem. It may not go away right away, but getting more people caring about it and involved and engaged in the conversation is the best trajectory forward to make an impact there. So, and again, talking.
Uh-oh, you're losing Nancy.
I think we lost Nancy.
Let me pick up on that one other step in this. In issues like this, we often turn to the law enforcement. Let's get the cops in there to stop this. There's another way to do it, and that is to put some youth workers who are not police into that community systematically every single night. Go there and talk about these things, talk to the kids, be there when this is going on. I think that changes the geography, at least, of the behavior. And I think it gives a message that is really important. And that message is, it's never too late to stop. It's you can always stop. And I think it was Caroline was mentioned about the ubiquity of people in recovery. I think it would be a great thing to recruit some new members to AA and NA in your community in exactly that spot.
Right. And I'll also add, I think Nancy was going there, but most of the participants on this call are within the Westchester community, and we're very fortunate to have a lot of very active local coalitions. My bet would be that you live in one of those communities, and I would encourage you to go and seek them out, find out how you can get involved, find out how you can tap into more resources and be part of the solution. I am going to put into the chat here the Power to the Parent .org website. There is a listing of local Westchester coalitions, so please take a moment to go in there, and we hope you will have a chance to connect. I think we're running out of time, so we have time for one more question, and it was directed towards Dr. I was going to say Dr. Dupont, but that doesn't help, does it? It's directed towards Bob. The question was, what have you seen, or have you seen any change with parents over the years in terms of acceptance of the actions of their child? Are they more open, less open? And as my personal add-on, is there any research to kind of back that up for parents to be able to kind of see where favorable attitudes or disapproval trends are going?
Well, one of the things that the earliest data on this back 50 years ago showed was that parents' attitudes make a huge difference in drug use. That's something that hasn't changed. And parents don't know that. They think that kids don't care what they think or wouldn't be influenced by it. They're tremendously, and one of the great predictors of non-use is parents who don't believe and don't think they should use. That makes a very big difference. But I think Nancy pointed out something that was really important, and that is that the parents of today were growing up in high school at a time when there was maximum, and this country's entire history, there was never any other period that had the kind of drug use that today's parents of adolescents had. So that their own experience was colored by a unique moment in history. And I think that a lot of parents are really out there to be educated about this. And what happened in the parents movement shows how important mobilization of parents is, and not just individually, but collectively, how much it makes a difference if parents think that all the parents in our community are going in that direction. I think that the opportunities here are great to be able to make it a community commitment to helping kids grow up drug and alcohol and nicotine free, and do it in a way that's caring and based on science and recognition of the vulnerability of that brain and how important that brain is and how vulnerable it is to addiction and what a tough problem it is to stop addiction once it's happened and how long lasting it is.
Great, thank you for that. And thank you again, Bob, Caroline, and Nancy, for all your input, comments. I think we have a lot.
Lisa, can I mention one more thing? And that is all the data here is available to everybody. So all the slides, all the data that you've seen is available for you to use. None of it is copyrighted. It's all available. Please use it in any way you can.
Thank you for that. And please look for that link. We'll include it in the follow-up email that you will receive within the next day.
I'll make sure you have that, Lise.
Yeah, absolutely. So thank you again for joining us tonight, everyone out there. And we hope that we will see you at the next webinar in November. Have a good evening.